from one of our Maui health professionals. Want to thank them for being here with us every morning on the Aloha Morning Show. It's Dr. Lee Weiss. Good morning, Dr. Weiss.
Good morning, Shane. How are you?
Man, we've been having some beautiful days here in Maui, aren't we?
Every day on Maui, even the rainy ones, are beautiful days.
That's
We're
true.
surrounded by the love of the residents of Maui, and Maui Strong holds us all up.
And we have the proper people in place to give us the correct information and answer some of the very concerned questions that we have from our Maui community. I've been getting a lot of other types of questions that is not really related to the actual health part of the COVID-19. But here's one from Dave that we got yesterday. This comes from the Maui Now website, and he says, how many COVID-19 related hospitalizations has there been on Maui?
That's a very, very good question. The vast majority of patients, as you know from all the news we hear, the vast majority of patients who get COVID-19 have an asymptomatic or mild disease that we would call an influenza-like illness, greater than 95%. Certain patients go on to have difficulty specifically surrounding pneumonia and shortness of breath and respiratory failure in some instances. This represents less than 3% of all of the cases. So it's a very low number of patients that are hospitalized all over the United States and on Maui. Hospitalizations on Maui have been under 15. The majority of the patients have done well. Not to make anything other than the tragedy that it is when anybody dies of a disease, put in the context of what's happening all over the United States. Number one, Hawaiians have done very well because they've listened about social distancing, they've listened about isolating themselves, and they've followed the instructions from the CDC, the government, and Hawaii and Maui public health officials very well. And they have done what's called flattened the curve, meaning fewer people are getting sick, fewer cases are occurring, and fewer deaths are occurring as well. And all of this is good.
Yes, it is. Dr. Weiss, I seen the other day, Maui had 2 new cases and Oahu had none. I was wondering, oh, wow, that's pretty neat.
So to date, if you were to compare, and I don't have the most up-to-date numbers, but as of yesterday, I would say the island of Maui had about 103 cases, and Oahu about 340, 360 cases. But both islands are showing a decrease in the total number of cases, meaning that the rate of rise of cases is now in negative, and that we're past that slope where we're starting to see the number of cases decline, and we're starting to see the number of hospitalizations decline, just like it's occurring in other places in the United States. But as we increase testing, and this is so important, as we increase testing, even of asymptomatic patients, we're going to find a lot of people who have had COVID-19 and were asymptomatic. And so that's something we all as a public have to be prepared for.
As Dr. Pang said the other day, more testing will give us a better understanding of where we at, who has been, like you say, been asymptomatic, and how do we proceed from that point.
That's right.
Dr. Weiss, would you say that the social distancing and all of the guidelines put in place has made the positive impact on the whole curbing of the outbreak?
It has, Shane. That's the number one thing that we've learned is that with social distancing, with avoiding crowds, with making these sacrifices to our daily life, we have changed the course of this pandemic. But let's make no mistake about it, it's something we're going to have to continue to do for a while.
Yes.
Even as we relax, even as we see many of the things on Maui come back to us that we're so comfortable and used to. The virus is in the background. It's not gone, and we're still going to have social distancing until we have, literally until we have a definitive vaccine that prevents us from getting that virus. And so even as we pass this surge, even as we do all the things at the hospital to guarantee patient safety, to guarantee the safety of employees, that virus is still ever present, and we must redouble our efforts at the on a healthcare basis to protect healthcare providers and protect patients alike. We have to social distance. We have to isolate a bit. We have to be cautious about being in public places. We have to distance ourselves when we can't have social distancing with a simple face mask. And by doing so, we will decrease the number of cases. We will decrease the number of deaths. We will institute a robust tracking system so that when a patient is identified, we can identify all of the individuals that they've had in contact with and quarantine and reduce those individuals from spreading it to another. And we're going to have to do this until such a time as we have a preventative agent like a vaccine.
And my point in saying what I said, if we can look at everything from the perspective, like I was telling the mayor, our attitude towards this whole new norm, we can see the positive effects that it brings. So it should be a perfect platform for us to look in the future and go, okay, the norm is going to change, but we can see the positive impact, so we'll be okay with the new norm.
Everybody's in the same boat. Everybody has to pull the boat forward. We all have to go in the same direction, which is health, safety for ourselves and our families and our communities. I think Maui can do this better than anywhere else because of the way people treat one another on Maui. Because of the community spirit on Maui, I believe Maui can really make this happen.
And we will, Dr. Weiss. I want to thank you again, my friend. Every morning, spending time with you and you answering the questions is very appreciated by all of our community. And we'll talk again. Another home run hit, my friend. Thank you very much.
Thank you, Shane. Regards to all of my friends in Maui, and look forward to speaking to you soon.
All right, Dr. Weiss. You have a good day. Aloha.
Aloha.